Well, it is the season full of germs, and that includes cold and flu viruses, which means it's important to know how to protect your family from getting sick in the first place.
This morning, we're talking to a Sanford doctor about what to watch out for. The Valley Today's Christy Larson joins us live from the clinic now. Hi, Christy.
Good morning, guys. Yeah, you know, a lot of people have that flu, influenza on their mind. They're concerned about it. They also know that there's a lot of cold symptoms going around, different viruses. So we're sitting here with Dr. Jeff Hunt, and let's just talk about how prevalent the flu is in our area. What are you guys seeing come into the clinic?
Oh, yeah, it's extremely prevalent this year. We're seeing quite a few cases. On a given day, I would say 25 to 30% of what we see is influenza.
I know a lot of times the symptoms can kind of be confusing. So again, quickly go over what the influenza symptoms are going to be when people need to come in and see you guys immediately.
Absolutely. So there's going to be a lot of overlap. You're going to have nasal congestion, sinus congestion, sore throat, maybe a mild headache with all respiratory viruses, or most of them anyway. But influenza is usually distinct by a few things. It's going to be fairly abrupt in onset. Within a day or two, you're going to notice all these symptoms show up, and they're going to be fairly intense. So, you know, really significant sore throat, a pounding headache, really significant body aches. You're not going to see those things with just a common cold.
So what do we do about it once we do recognize what it is? If it's a cold or if it's influenza, what should we do after that?
Well, if you think it's flu, you should get checked out, mainly because within 48 hours is when our medicines work the best, and especially if you're at a high risk, if you're a high-risk patient. So if you're over 65 or you're a young child, or if you have chronic medical problems like heart disease, lung disease, chronic kidney problems, things like that, you want to be checked out quickly because you could have serious complications from influenza. So I would say come in right away if you're seeing those symptoms. If it's just kind of the sniffle, so to speak, nasal congestion, sinus congestion, you're not having a high-grade fever, otherwise feel okay, then it's probably not. Then try those over-the-counter medications like we previously discussed.
Yeah.
Okay.
I know one of the things, too, that we had mentioned to each other, too, is even if you do get the flu, you didn't have that vaccine this year, it's never too late to get it.
Exactly, yeah. With the different strains that we have out this year, it's still, you could have been exposed to one strain but not the other, so getting a flu vaccine is still important even if you've had the flu.
Yeah, and of course, keeping up with washing your hands, making sure that if you do cough or sneeze or maybe get sick, you need to cover your mouth, cover yourself. And guys, it's important to talk to your kids about it too. We want to make sure that they're keeping their germs not only to themselves, but try not to get everyone else's as well.
Christy Larson reporting live. Good advice. Thank you.